Much appreciated, Nandi. Thanks indeed. Now we continue our focus on the National Health Bill this morning. Discovery had broadly supported the proposed reforms, but in submissions to Parliament last year, it rejected the single funder model as unworkable. We joined now on the line by Dr. Ryan Noach, Discovery Health CEO. Dr. Noach, thank you again for your time. Dr. Patla says this is a revolutionary bill because it will now give universal access to quality health care to all and sundry regardless of your income. Why, in your view, would this not work?
Good morning, Cindy, and thanks very much for having me on the show. And as you correctly said in the introduction, we are actually very supportive of a national health insurance scheme in the country. We think it's unacceptable that there are many South Africans, 40 million plus, who simply don't have the access that they deserve to high-quality health care, and that there is an inequality in the system because in the private sector we deliver very high-quality health care consistently. So we find that situation untenable, and we have been calling for and support simultaneous reform in the private and the public sector. And the NHI being the ANC's chosen approach to this, we absolutely support an NHI. Our assertion is that this should not be on a monopolistic basis. The current draft act in its section 33 sets out that the NHI will be the only funder of most healthcare services, save for a few top-up services. And we think that a multi-funded or blended funding model would be far more pragmatic. In fact, we think it's fiscally much more feasible. We don't believe the current model is feasible, unfortunately. And actually, if you look around the world and look at the global healthcare systems, we can't find an exclusive model of this nature anywhere else in the world, even in the United Kingdom, where the famed NHS, the National Healthcare Service, is successful.
Now, Dr. Noach, because of the uniqueness of the South African history and the imperative of redressing injustices where the majority were excluded not only from economic participation, but also access to quality health, education, etc., are you saying that the National Health Bill, as an imperative of the National Development Plan, also needs to be reformed? I'm just trying to understand, as it stands now, it is likely to become law once the President has signed on the dotted line.
Yeah, Cindy, I'm not sure I fully understand your question. I mean, it is absolutely clear to us that almost 30 years after the end of apartheid, there is a legacy of unfortunate inequality, of unacceptable and untenable inequality that extends across our country in all spheres, including healthcare. And that really is largely a consequence of this terrible political past. That, I think, is common cause, and we completely agree with that. Further to that, the NHI bill has got many strengths in it, and we would like to support this bill. We think an NHI is feasible, and we think that simultaneous regulatory change is needed in both the private and the public sector in order to try and narrow some of these inequalities. The part that we've suggested be changed, and by the way, many stakeholders made suggestions to the parliamentary process, almost all of which have been ignored. We think that there should be a multi-funded or a blended funding model, and we think actually that would be far more sustainable for the country. Our worry is that the country does not have the resources for the single system that's envisaged, which, you know, some of the estimates at this point, even from the Department of Health, are saying will cost somewhere between 550 billion and 700 billion rand a year. Over 10 years, 5 to 7 trillion rand. We don't see the fiscal headroom in our economy for this structure, and we've put forward suggestions around other structures to help address these inequalities.
Yes, so Dr. Noach, I think where I'm coming from is also from a South African who has elderly parents who may not be on medical aid. Now, while we have professionals who may afford quality health care, it is also disheartening when a loved one has to access public health services that are not adequate. So if this National Health Bill will then widen the pool of how we can access health care, I think we agree in principle on that one. If it were to roll out as it stands, will this give consumers an option where you can contribute to your private healthcare medical aid scheme, and also maybe for loved ones in this case take the option of the NHI?
Yeah, Cindy, two parts to your question. Let me answer them separately. In the first instance, it is a great concern that, public sector healthcare delivery has deteriorated to the extent that it has. And I share your concern, yours being a personal one. We're seeing this at a population level. We really do share the concern around that. Our view, and in fact, this was expressed by the Minister of Health in Parliament. The Minister of Health's words were, not quoting him verbatim, of course, that the first 200 billion rand in the healthcare system is needed for public sector health system improvement. We need to invest in the hospitals and in the health sector delivery systems. And without that health system improvement, this NHI will not work. So in the minister's own words, that's where the first investment should go. And when it comes to people like your parents, exactly, this health system improvement is absolutely necessary. The second part of your question, will people be given a choice? Section 33 of the draft bill says the following in simple terms. It says that when the NHI is fully implemented, I'm quoting there, fully implemented, as deemed by the Minister of Health, so at the discretion of the Minister of Health, at that point in time, and we think that's more than a decade away, but at that point in time, medical schemes will not be allowed to provide the same services as the National Health Insurance Fund. So that means that people will not have a choice, to answer your question directly. At the point that the minister deems the NHI is fully implemented, people would not have a choice. They would only be able to access care through the NHI fund, which would be the single funder in the system and would be contracting all medical providers and healthcare professionals. That's an environment of a monopolistic funder, a single funder negotiating all care for all South Africans. We can't find precedent for that anywhere in the world, and we do not believe that's sustainable. And of course, there's enormous concerns from healthcare professionals and medical providers who would be negotiating in an uncompetitive environment and who don't believe that's feasible.
And you're saying the unintended consequence would be that medical aid service providers would then also migrate elsewhere where their services would be, where people can afford it, and possibly even human capital that could be lost, Dr. Noach. But just talk us through what the next phase is going to be.
Sorry, Cindy, just to interrupt you, actually, that is the largest short-term risk that you raise of this policy. In the short to medium term, our concern is not the sustainability of medical schemes. And in our view, they will be around for a long time still, a very long time, because it does require the NHI to be fully implemented first, which in the Department of Health's own terminology is 10 to 15 years away. The immediate risk is the one, Cindy, that you just raised, which is that this has caused real concern amongst scarce skills, healthcare professionals that are not in abundance, about world-leading hospital groups and medical service providers right across the system. And we fear that there will be a lack of ongoing investment in these resources and a brain drain to some extent. The sentiment is extremely negative there. And that, as you point out, Cindy, is by far the biggest short to medium-term risk.
And very briefly, Dr. Noach, before we let you go, what happens next if the bill were to be signed into law as it stands?
Well, Cindy, there's still a long way to go on that process. As we understand it, now that it was approved yesterday by the National Assembly, it needs to go to the National Council of Provinces for approval. And that process includes provincial public debate and provincial public opinion in each of the provinces. So each province has to have public hearings to debate the bill. And then ultimately, the National Council of Provinces would need to approve the bill. Section 32 of the bill currently proposes that about 50% of provincial health budgets are removed from the province and centralized in the National Health Insurance Fund. So at the National Council of Provinces, the premiers will be no doubt debating the fact that they're losing about half their health budgets, which are currently allocated to them from Treasury. And we understand that this is raising material concern amongst some of the provinces and that there is not necessarily a unanimous support of that particular issue. Anyway, once the National Council of Provinces approves this, which it seems along party lines is happening at various structures. It would then go back to the National Assembly for further debate and ratification, and our understanding is then it's referred to the President for signature to be promulgated into law. During the Parliamentary Portfolio Committee hearings, there were many stakeholders who expressed a very clear intent to litigate against this bill should it proceed unamended.
All right,
I'm sure you know, Cindy.
Yeah, Dr. Noach, that was my next point, in that there possibly going to be a lot of litigation, but I hate to interrupt you there. We are fresh out of time, and really appreciate you joining us this morning, reflecting on the National Health Insurance. That is Dr. Ryan Noach, the CEO of Discovery Health.